I'm Sarah and I'm a PhD student at the University of Manchester, where I research a disease of the brain called stroke. Throughout this video I'm going to introduce what a stroke is, the different types, and then afterwards we're going to have a go at making our own slime blood clots. Blood plays a very important role in our bodies. It carries all the oxygen and nutrients around our bodies in order for us to be healthy. Blood is transported around the body in small tubes called blood vessels. Veins and arteries are two types of blood vessels. The brain is one of the most important organs in our body and needs a constant supply of oxygen and nutrients from our blood to allow us to move, speak, think and feel. You name it, the brain controls it. So what is a stroke? Sometimes, when a person gets sick, blood can get stuck in these vessels, causing a blockage called a clot. When this happens in the brain, we call this a stroke. The clot can stop blood travelling along the vessels in the brain and stop the brain from getting oxygen and important nutrients. This causes blood vessels and brain cells to die and may affect how a person talks, walks, thinks, and in serious cases, the person may not survive a stroke. All you need is some red paint, and this resembles our blood. We need some white PVA glue, and this represents all the other bits and bobs which are in our blood to keep it nice and healthy. We'll also need some bicarbonate of soda and some contact lens solution as well. So what we need to do is add equal amounts of the red paint and the PVA glue. And then we just need to add a small amount of the bicarbonate of soda, so maybe like 1/4 teaspoon. If we give this a mix together, what we are forming is our normal, healthy blood. So pause here and have a go yourself. When something increases the chance of having a stroke, we call it a risk factor. Examples of stroke risk factors include smoking, obesity, heart disease, and old age. Some risk factors, such as old age, are unavoidable, but it's important to consider how we can lead a healthy lifestyle to decrease our risk of having a stroke. Risk factors which we've just mentioned, we have here represented as different coloured glitter. So we have smoking as a risk factor, we have heart disease, we have obesity, and we have old age. So if we add one of these risk factors to our nice healthy blood, for example if we add some obesity, so you can use glitter, you can use beads, you can use sequins, just add a big old amount of that to our healthy blood. And then we want to give that a stir with our contact lens solution as well. And then if you see what happens as soon as we add this, what you should notice is that the blood is becoming a lot thicker, gloopier, it's clumping together, and it's just looking a bit gross. So what this is it can happen inside our own body. And if this happens in the brain, then it means that oxygen and all the really important nutrients that we need can't get into the brain tissue, and this can cause a lot of damage. Pause here and it's your turn to make your own slime blood clot. Currently, we can help people who've had a stroke by using treatments such as clot busting drugs. These break down the clot into the blood vessel and allow blood to flow around the brain normally again. Unfortunately, these clot-busting drugs only work in around 2.4% of people who've had a stroke, and because of this, we are always working on new ways to help people who've had a stroke. So our research, the cells of our immune system called white blood cells, helps fight off infection. White blood cells release chemicals to fight off the bugs and nasty things that enter our body. This is a good thing, and it helps stop us from getting sick. These chemicals produced by white blood cells are not so helpful when they are in the brain though. They are released after someone has had a stroke and they can cause further damage to the brain. So our research looks at how these chemicals can cause this harm to the brain and what we can do to stop it. A treatment developed by our lab called IL-1RA works to protect the brain from chemicals released from white blood cells and can improve the outcome of someone who has had a stroke. This video was created by the Brain Inflammation Group at the University of Manchester. For further information on our research and what we get up to as a lab, visit www.braininflamelab.org. Thank you very much for watching.